For decades, kidney stones have been one of the most dreaded medical conditions a person can experience. The sheer intensity of pain caused by these hard mineral deposits, often compared to or even surpassing childbirth, makes them infamous in the medical world. Traditional treatments like shockwave lithotripsy, ureteroscopy, or even surgery have provided relief to millions, but they also come with their share of drawbacks: pain, tissue damage, longer recovery times, and sometimes incomplete removal of the stones. Now a revolutionary development in the field of medical microrobotics promises to change that narrative. A team of scientists from South Korea and the United States has successfully developed a microscopic magnetic robot nicknamed the Microrobot that can travel directly into the urinary tract and break down kidney stones with far greater precision and less discomfort than conventional techniques. The Microrobot is a magnetic, spider-like microrobot that can be guided externally using carefully calibrated magnetic fields. Its design may look futuristic, but its function is simple and highly effective. It travels into the urinary tract, locates the kidney stone, and then uses controlled vibrations and micropulses to break it apart into much smaller fragments. Unlike shockwave therapy, which blasts kidney stones from outside the body and can sometimes damage surrounding tissues, the Microrobot works directly at the site of the stone. This precision minimizes collateral harm, while ensuring that the fragments produced are small enough to pass naturally through urine, reducing pain and avoiding the need for additional surgical intervention. The beauty of this method lies not just in its effectiveness, but in its elegance. Instead of relying on brute force, the robot takes a careful, localized approach, breaking stones down piece by piece without overwhelming the body. If successful, the robot could represent a major leap forward in minimally invasive, targeted medical procedures. Let's dive deeper into this exciting development. To truly appreciate the significance of this innovation, it's crucial to understand the challenges posed by kidney stones. These hard deposits are formed from substances like calcium oxalate, which can build up in the kidneys over time. When small, they might not cause any noticeable problems, but larger stones can obstruct the ureter, the tube connecting the kidney to the bladder, and block the flow of urine. This blockage leads to severe pain, nausea, blood in the urine, and a heightened risk of infection. Traditional treatments for kidney stones include shockwave lithotripsy. This non-invasive procedure uses focused sound waves to break stones into smaller pieces. While effective, it can cause bruising, bleeding, and incomplete fragmentation. Ureteroscopy. A thin scope is inserted into the urinary tract to locate and remove stones. Larger ones may be broken apart using a laser. This method is invasive, requiring anesthesia, and carries risks associated with any surgical procedure. Surgery. In extreme cases, surgical removal of the stones and the affected ureteral segment might be necessary. This approach carries all the risks of open surgery and lengthy recovery times. Each of these existing methods has its limitations. Shockwaves are non-invasive but can damage surrounding tissue. Ureteroscopy and surgery are highly effective but are invasive, painful, and time-consuming. This is where the Microrobot emerges as a beacon of hope, offering a potentially less painful, more precise, and faster recovery solution. The Microrobot's mechanism of action is straightforward yet highly effective. It achieves three critical objectives: magnetic navigation, guided by external magnetic fields. The robot can navigate the complex pathways of the urinary tract with great accuracy, ensuring it reaches the target kidney stone without causing damage along the way. Localized vibrations and pulses. Upon reaching the stone, the Microrobot uses focused vibrations and mechanical pulses to weaken and break it down. This localized approach reduces collateral damage to surrounding tissue and organs, minimizing fragment size. The robot is designed to produce fragments small enough to be expelled naturally through urination. This eliminates the need for additional procedures to clear out the fragments and reduces the risk of recurrence. Currently, the Microrobot is undergoing rigorous testing and clinical trials before it can be rolled out for widespread use, but initial results are extremely promising. In tests on live pigs and simulated human urinary tracts, the Microrobot achieved a 90% success rate in 9 out of 10 cases. It effectively fragmented kidney stones without causing major complications. These positive results paved the way for human trials, which will further evaluate the robot's safety, efficacy, and potential advantages over existing treatments. The Ferrobot holds immense promise for treating kidney stones, but its impact extends beyond this specific application. It ushers in a new era of medical microrobotics, opening doors to previously unimaginable possibilities. Imagine a future where microscopic robots patrol our bloodstream, identifying and eliminating threats before they become life-threatening. Here are some potential game-changing applications made possible by this technology. Cancer treatment. Microrobots could deliver chemotherapy drugs directly to tumor cells, minimizing damage to healthy tissue and increasing treatment efficacy. Vascular repair. Tiny bots could swiftly remove blood clots from arteries, reducing the risk of heart attack and stroke, or repair damaged blood vessels without invasive surgery. Targeted drug delivery. Medications could be released exactly where they are needed in the body, reducing side effects and improving therapeutic outcomes. Minimally invasive surgery. Microrobots could perform delicate surgical tasks from within the body, eliminating the need for large incisions and reducing recovery times. These possibilities underscore the transformative potential of microrobotics in medicine. The Ferrobot stands at the forefront of this revolution, showcasing what can be achieved when technology and healthcare merge to address critical needs. As with any new medical technology, challenges lie ahead for the Ferrobot. Key issues include scaling up production for wider use, navigating the complexities of the human body, and addressing potential patient concerns about robotic procedures. However, given the potential benefits and the incredible progress already made, it is clear that we are on the cusp of a major breakthrough in kidney stone treatment and broader medical microrobotics. The Ferrobot represents a significant step toward a future where kidney stones are no longer a source of dread and pain. Rather than facing weeks of agony, hospital stays, and invasive procedures, patients could soon opt for a minimally invasive, less painful robotic treatment. More than that, the Ferrobot embodies a larger medical evolution. Surgical interventions may be increasingly replaced by microscopic, intelligent, and precise robotic solutions. As microrobotics advance, we could see tiny bots tackling an array of health challenges from cancer to vascular diseases, revolutionizing healthcare as we know it. The tiny Ferrobot crawling through the intricacies of the urinary tract may seem like a small-scale endeavor, but it marks a giant leap toward a future where medicine and microtechnology converge. This journey started with kidney stones, but the destination is far more expansive, touching upon all facets of internal medicine. The era of robotic precision at the micro level is dawning, promising to transform healthcare and redefine what's possible in the intricate world within us.